Hello everyone and welcome. Today's presentation will be on cognitivism for the Airmen and Family Readiness Center. Cognitivism is discussed in many different environments in current times. Learning and developmental environments especially can correlate with cognitivism because of the research we conducted on what it takes for these environments to be successful. Today I will be discussing cognitivism and the military child. The military child goes through so many obstacles aside from just being a child. With cognition, this is also the process of thinking, problem solving, engagement and collaboration, and memory. The military child. As most of you know in this environment, the military child has or can have a stressful time. They are moving around to different countries or within the country, being away from loved ones, extended family. Sometimes their parents are deployed or both parents, and then having to go through life without a parent can be a definite issue when it comes to routine and emotions. With moving adjustments to new schools, with that comes losing friends or making new ones. On top of all of this, they can be dealing with the stress of a parent in a dangerous environment, whether it's deployments to Afghanistan, Africa, Iraq. We're everywhere these days, and the kids are left behind worrying about their day-to-day life as well as their parent. Now I'm going to discuss Piaget's cognitive development theory. In this theory, there are 4 stages: sensory motor, pre-operational, concrete operational, formal operational. Within these stages of cognitive development, when you start out, it's with movement, touch, and feel as a child. And then we get on operations on a day-to-day basis. So we're talking, today I'm going to eat breakfast, and then I'm going to brush my teeth, get dressed, etc. Concrete operational is where we're already having those routines established, and so it's not a lot of information processing going on what to do next, because the child already knows and they can operate these routines successfully. Formal operational, this is when outside factors can come in, different stressors, new changes, and they're still able to operate cognitively with these changes. Cultural education and societal influences can definitely have an effect on each stage. I want to talk about specifically with the military child. Our culture is a lot different from everyone else in society. Like I mentioned before, with deployments, moves, different schools, like these can all have a big impact on the child as they're going through these developmental stages. So when it comes to reaching each milestone, they may be behind or forward. It all depends on their environment and what's going on at the time. Cognitive development. On this topic, I want to hit on language first. So there are talks and studies have been done on language being acquired more than learned. So more than the child cognitively processing language, this is just acquired. And this can be with routine. So if you're, feeding your child, bathing your child, reading books to your child, this is how they see you doing things throughout the day, and they're going to pick up on these behaviors and learn how to speak, learn how when you're doing certain movements, it means a certain word. Parents are also a big factor in cognitive development. And in this community, in this society of the military, we see parents going through multiple stressors throughout their career and throughout their time with the military, and this can have an effect on their children. It's important to take kids into consideration when decisions can be made, and a lot of times those decisions are out of our hands, as we understand, but the children do not understand that. So it's important to check in and make the time to understand what they're feeling if they have questions about what's going on. And the same goes with educators. Most military installations do provide schooling through the DoD. Some don't. So it's important, if they don't, to also have talks with educators on what this child can go through that's different from other children. Sudden absences, for instance, if you're moving short notice, or if a parent is being deployed, just the communication between parents and educators can really help when it comes to cognitive development, so the child's not walking into anything to where they're not being understood. This goes with relationships as well. Cognitive development includes relationships with parents, friends, educators. We're talking about a first friendship. Let's have an example of moving to a new base, and a first friendship and development makes way for the future friendship. So how that goes, how a friendship or first interactions with a parent go, this really sets the standard for how other relationships are supposed to be within this child's mind during cognitive development. Now I want to talk about the cognitive load theory. The cognitive load theory includes a couple factors here, with multitasking, outside factors such as friends, extended family, what that child's going through in school or with friends and family, like we talked about, parents' deployments and things like that, and focus. Is this child, with everything that's happening around them, are they able to focus on what's important at that specific time? Interference. So we'll go back to multitasking. Cognitive load theory, I'll give you an example. A child has a test on Friday. They've been studying for this test, but then their parent just had to go on a deployment for 6 months. So they're stressed out about their parent being away, which interrupts their routine, as well as worrying about that parent. With these two things going on, are they able to focus and study on that test that they have on Friday? We work with cognition and what's going on in the brain, thinking, can this child, with everything that's going on, what do I need to do to help this child focus on what's important to them now, without explaining to them that anything else is less important, but there's a way to prioritize things to get, for this example, school done, while also putting the time aside to check in and talk about the parent and the stressors that they're going through. The cognitive load theory discusses how different interferences can affect their focus, and there's been studies done on examples that children diagnosed with ADHD or autism on the spectrum, they have a couple issues with cognitive load theory. They are not able to, or may struggle with, prioritizing certain tasks with outside factors happening. With our services and what we can provide is counseling to let them know that while outside factors may be stressing them or causing mixed emotions, it's okay to task them out, to be able to say, I need to focus on this right now, and then we can come back and talk about the other issue, vice versa, with everything that's going on in their life. Help for parents and children. When discussing the cognitive load theory, or even cognitive development in general, it's important to let the military children and their parents know that putting aside time to discuss everything that's going on in their lives can help everyone recoup their emotions and answer any unanswered questions or hit on any feelings the child is going through that may be interfering with what they're going through with education and their outside relationships. minimizing stressful situations where people. With military children, it's hard to minimize stressful situations when a lot of things are out of our control. So what we can do is minimize the stressful situations that are in our control, such as establishing a routine at home and in school can help so much by putting the child in control, whereas they feel out of control everywhere else. This wraps back up with checking in. As counselors, educators, and parents, it's important to check in. A lot of the times we may not know what a child's going through or what they're feeling if we're not asking. And in this environment, there's so many extra factors that go into how are they feeling throughout the day, on top of what a regular child has to go through without these extra stressors. Let's talk about memories now. With cognitivism, a lot of studies and research have been done on memory. What I want to hit on right now is the good and the bad. Especially with airmen and their families, there's of course going to be good and bad memories. So we'll hit on episodic memories, emotional memory, recalling past experiences, and cognitive reprisal. Good and bad memories can affect how a child goes on throughout their life with this in their mind. In the past, and especially in the psychology field, it has been explained that recalling bad memories can bring up negative emotions in a children, and this can possibly turn into post-traumatic stress disorder. In more recent years, neuroscience studies have proven that positive effects of recalling good memories can have on an individual. More studies have even shown that the encoding process and cognitive reprisal being used to reestablish certain experiences to be less negative when the individual recalls the memory. These processes can be used to lessen the negative effects of the memory. So what this will involve with recalling past experiences in a counseling situation, for example, you have a military child come into your office with a bad experience. We could revisit that bad experience, explain it in a way that they might not have understood at the time, hitting on their emotional memory, what they felt in that moment, and kind of going back to recreate a memory of where it doesn't stress them out or negatively affect them as much as it did, which, to wrap that all up, would be cognitive reprisal. Redefining how memories can make an individual feel is useful, especially in military children, for all the memories that they go through at an early age, especially memories of being separated from their parent or even, unfortunately, the loss of a parent. Turning stressful experiences into fond memories. Some examples we can give to military children and their families, especially the parents, though, is creating a new tradition. With all the moves we go through in the military, creating new traditions can put a positive aspect on a more stressful experience. For example, if you're moving to a different state and there isn't snow where there used to be snow in your previous state, creating a new memory is making snowflakes with your child to think back on the good memory of snow during the holidays, but also having that fun time with family creating something new. Involve the children in what is happening where it's appropriate. For instance, with a move, let them know when it's going to happen, what they can expect, things about their new school that they can be excited for. Provide choices in this new environment so they feel like not everything is out of their control. An example of this is, what do you want to wear on your first day at your new school? Or what's a good idea? What do you think you want to have for dinner for the first week we get there? Things like that can help the child feel included and take the stress off what could be a bad experience turning into a bad memory and creating new good experiences to kind of overload those bad memories. Now, the information processing theory. How do children process information in their brains? I want to give you an example here. Let's say there's a child